Thanks very much, everybody, and thanks for waiting. We are halfway through our month of measures to curb the spread of COVID-19 across our communities, and today in the Executive we have considered the impact of the tighter restrictions on infection rates. And it's fair to say there are green shoots of hope, and as the Health Minister outlined earlier in the week, the North West area has seen an encouraging decrease of over 50% in positive cases. In fact, right across Northern Ireland, we are seeing a steadying of the number of people who have been diagnosed with the virus. The medical and scientific advice is that the R rate for case numbers has dropped below 1 for the first time since the early summer, and indeed it is below 1 in 10 of our 11 council areas. And whilst this is good news, we have still more work to do. And very sadly, we are seeing the heartbreaking news that over this last week, the numbers of those who have died has risen by 47. And our thoughts and prayers are with you, and indeed with every family that has been touched by this brutal and unrelenting virus. We are all in this together, and there is evidence of the impact of the restrictions being observed. From publicly available data compared with a baseline from January and February of this year, activity with the current restrictions has decreased significantly up to October 20th across a range of areas. Public transport usage is down by 49% in Northern Ireland, recreation and retail by 33%, workplaces by 41%, and park visitors by 26%, all lower than the UK-wide picture. Supermarket and pharmacy activity is also down by 8%. And the Executive is committed to supporting all of those who are experiencing difficult times during this pandemic. Today, we have put in place a package of around £687 million to support people, jobs, education and, of course, our health service. This includes around £61 million for supporting the continued safe education of our children and young people, an additional funding of £7.3 million for our local hospices and cancer fund for children. Up to £25 million will be made available for 2 new support packages for taxi drivers and private bus or coach operators. £6.5 million for a blend of community initiatives to support those in need, and we are committing around £500 million to the health service. We have discussed additional support for dealing with the current surge, our health service capacity, test and trace arrangements, and indeed progress on a new rapid testing. We considered the stepping up of ICU beds at the City Hospital Tower Block and elsewhere, and raised the available workforce with the Health Minister and whether there is scope to expand beyond the pool available to us. We do recognise, of course, that highly skilled anaesthetists and ICU nurses are relatively finite. However, we are hearing of simpler issues where we might be able to help spread the load and make the system more efficient, such as in cleaning and preparing ambulances for turnaround. So we are immensely grateful for the efforts being made across our health and care services, and the number of staff off work is actually lower than it was last week. The Health Minister updated us that around 4,500 staff are currently off work, but 3/4 of those are with what would be considered standard sickness for this time of year, and the absence of approximately 1,100 staff is COVID-related. So that's equivalent to 1.6% of the workforce, which is in keeping with our first surge in the spring of this year. We were also advised that 10% of the 2,700 people who have responded to the workforce appeal have already been appointed or their appointment is imminent. Officials in our civil contingency group are meeting again on a regular basis. So as I've said before, we're now living with the reality of COVID-19. But we have learnt a lot over this past 7 months. We know more about how it is operating in our community and the many ways we can keep each other safe. The Stop COVID-19 app is a very good example of this. That is proving to be a very powerful tool in identification and tracking of cases. and it now has interoperability with Scotland and Jersey, as well as the Republic of Ireland, and we're hoping that England and Wales will follow soon. Our local teams are to be commended for their innovative and groundbreaking work, and I would urge everyone to download the app if they haven't already done so, because we must redouble our efforts. This weekend we have Halloween, and while we would like all those who are young, and indeed young at heart, to fully enjoy themselves, we would ask that you do so safely and in line with the public health guidance. Of course, on Monday our schools will reopen after their short break, and the Education Minister updated the Executive on measures to mitigate against schools-related spread of the virus. Whilst rates of transmission are low in school, it is the activity and mingling outside of school, for example at school gates, that is of particular concern, and messaging will be rolled out on that issue over the coming days. The Executive has also agreed today that face coverings will be mandatory for all post-primary school children on dedicated home-to-school public transport, and exemptions will apply, for example, of course, with those who have special educational needs or indeed other relevant disabilities. So we are seeing positive signs that our efforts are having an effect on the virus. We have 2 more weeks to go in these current restrictions, so we have a lot to gain, and I'm asking people not to slip back, but actually to stay safe and to save lives. Michelle.
Thanks, Arlene, and good afternoon to everyone who's joined us. Sadly, today we've learned that another 8 people have died as a result of COVID-19. This week we also lost the youngest member of our community who died after contracting COVID, Aaron Doherty from Derry, who was just 17 years of age. Aaron's daddy, Jim, has paid tribute to his beautiful son, describing him as a wee gem. As mummies, I can't even begin to imagine the pain that's being felt by Aaron's parents, Jim and Susan, at this devastating time. I want to send our heartfelt sympathies to you both, and to Ryan and Samantha, Aaron's brother and sister, and to each and every family member who has lost a loved one as a result of this virus. Aaron's passing is a cruel and a heartbreaking reminder of the seriousness of the situation that we're faced with. If ever we needed a reminder of the dangers we face, this is it. We're almost at the midway point in the emergency 4-week intervention to stop the spread of coronavirus across our society. Infection rates a fortnight ago had reached crisis levels and were multiplying by the day. Decisive action was needed to protect people, save lives and reduce pressure on our health service. And as Arlene said, we are starting to see some of the evidence that infection rates are starting to level off, and we hope to see cases fall even further in the coming days and weeks. We want to thank each and every one of you for your efforts. You have been absolutely great. But this is not a time to drop our guard. We need to do more. We need to keep at this and to achieve the reduction that's needed in the R rate. We are all depending on each other and every person to continue to do their bit to stop this virus from spreading. We only need to look to the people of Derry and Strabane as the exemplar of what can happen when everyone unites together to fight back against COVID-19. They have stepped up and they've made serious effort to protect each other, and it really has paid off. They have driven the infection rate down, and they have no doubt saved lives. We ask everyone to go at this with the same commitment and the same determination as the people of Derry and Strabane and what they have shown. We, as an Executive, are committed to communicating as clearly as possible with you on what we will do. We're working across government and across society to use every network and every platform to get the message out and about how our actions can make a difference. There's no doubt in our minds that we're facing into a very tough winter. And today, our Finance Minister, Conor Murphy, has brought forward a funding package worth more than £750 million that will help to support public services, workers, families and communities throughout this period. This is a funding package that prioritises the health service and education and protects those most in need. Over £500 million has been allocated to the Department of Health to bolster our health service and support our frontline health staff, who are working tirelessly to provide us and our families with the best possible care in the most challenging of circumstances. It will help fund the response to the public health emergency and enhance the Test, Trace and Protect programme, which is the cornerstone in our ability to respond effectively to the pandemic. I am delighted that today's package includes a further £7.3 million funding for our hospices, who play such a vital role in the delivery of health services to thousands of children, infants and adults. The NI Hospice, the Children's Hospice, the Foyle Hospice, the Southern Area Hospice, Marie Curie and the Cancer Fund for Children have touched the lives of so many people. They provide dignified and compassionate care for people at the most challenging and difficult times in their lives, and they bring great comfort to families. We deeply value the work of the healthcare staff, the support staff and the volunteers, and we hope this funding will support them to do the amazing job which they do. The education and welfare of our children is a real priority for the Executive. Our schools will reopen on Monday, and more than £61 million has been allocated to meet increased education pressures. This will include funding to provide a safe learning environment for children and young people and provide free school meals and uniform grants. It also includes nearly £12 million to address educational authority pressures, including provision for special educational needs. £19 million will be provided much-needed financial assistance for the taxi and private bus and coach sectors, and a further £6 million has been held centrally to support the sector if the Minister came forward with additional schemes. £15 million will be allocated to sports organisations to help sustain them through this period of lost income. And £6.5 million will be used to provide emergency community support and food packages for some of the most vulnerable people in our society. This is a hugely challenging time for everyone, and we hope that this funding will help to alleviate some of the pressures that are being felt. And just to finish, a reminder to everyone of the basic steps that we all can take to limit the spread of COVID-19 as we enter into Halloween weekend. Please limit your contact with others. Wash your hands, keep your distance, wear a face covering, download the Stop COVID app, and if you have symptoms, self-isolate straight away and book a test. Thank you.
Good afternoon, Tracy McGee, UTV Live. Can I start by asking the Deputy First Minister, what attitude would you say Sinn Féin has to financial matters when it's appeared that 3 of Sinn Féin's offices received £10,000 in error, and it took 7 months for that money to be paid back, and that former MP and now former Senator Alicia McCallion admitted when she apologised that the money had been paid into a joint account with her husband, and she didn't do anything about it until Tuesday of this week?
Well, firstly, Tracy, let me say what happened was wrong, and it's totally unacceptable. The party leadership has correctly moved to take decisive action. As soon as I was made aware of the situation on Monday evening, we moved immediately to establish the facts and to take action, and that's what we've done today. We have said, Mary Lou, as the party leader, has said today that she acknowledges these failures and she apologised for these failures, and I believe that the correct action has been taken in terms of us accepting the resignations of those who've been deemed to be accountable for and responsible for these issues.
Yeah, but the question was about Sinn Féin's attitude towards money, and how can anyone believe that there's any kind of integrity there when this happened over 3 separate offices and nobody thought to give this money back? And just then, as part of a follow-up to the First Minister as well, we're told that one MLA within the DUP, their landlord, has received money. What can you tell us about that, and why are we not being told the identity of this MLA?
Well, firstly, Tracy, let me say again, unequivocally, what happened was wrong. I can be no clearer than that. I believe what happened was wrong, but I do believe that we moved speedily to correct what was wrong. So as soon as we became aware, we set ourselves the task of establishing the facts, which we have obviously now done. We established that 3 offices had received this grant funding, which, as you have acknowledged yourself, they did not request. However, it is wrong that the money wasn't returned immediately. So we set ourselves the task of establishing the facts, and when we did so, our first task was to make sure the money was returned immediately, and secondly, it was to take action, and we accepted the resignation of those people that were deemed to be responsible and accountable for this issue. I take the issue of public money very seriously. I also take the issue of whenever you hold public office, you have responsibilities, particularly when it comes to public money, to make sure that you are fully compliant with all the rules, all the regulations, and that you are open and transparent in all of that. I expect that from every single elected representative in Sinn Féin. We have been very clear and very decisive today in saying that what happened was wrong and it was totally unacceptable, and we did move speedily to correct what we believe was wrong.
So, Tracy, let me say first of all, no DUP elected representative has received this £10,000 grant. I think it's very important that I say that and be on the record in relation to that. And indeed, I well recall the discussion at the Executive at the time of this grant, because it was being based on the Small Business Rates Relief Scheme. That we made sure that political offices were not involved, and indeed wind turbines. And I know some of those have slipped through the system, and of course we will have to look at how that happened. But in terms of landlords, I don't think any tenant can be held responsible for the actions of a landlord. If a landlord has received money that he should not have received, or she for that matter, then it should be returned if it hasn't already been returned. And if it hasn't been returned, then I would very clearly say that the Department of Finance should pursue that company, that person, whoever it is that is the landlord. As I say, you cannot expect tenants to be responsible for the actions of their landlords, but I think it is very important that if there is someone who has received money as a landlord, then it has to be paid back if it hasn't already been. Can't hear you. End up. Nearly in chorus.
I seem to have this problem all the time. Good afternoon, Ministers. Just picking up First Minister on this whole issue around the landlord. If it is the case that this money hasn't been paid back, and are you able to tell us today if it has or it hasn't been paid back, surely your party should sever their link with this landlord, because this is public money and it should not have gone to the landlord that it's gone to onto the system the way that it's currently established. And a question to the Deputy First Minister, isn't the reality here that had it not been for the Stephen Nolan programme investigation, that £30,000 would today still be sitting in the bank accounts of Sinn Féin?
Well, first of all, and I think it is important to say that this scheme was designed not to benefit politicians, and that was put in place so that it wouldn't happen. Unfortunately, there has been some politicians, and indeed it appears at least one landlord who has received this money. It has to be paid back because it is public money. This scheme was never designed to benefit politicians or indeed landlords of political offices, because it was put in place, and we need to look at why it was put in place. It was put in place to help businesses that were absolutely struggling at that time. It was there to get out quickly, to benefit those businesses and to keep people in jobs at that particular point in time. So there is no way that politicians or landlords should have been in receipt of that money. So if there is an office that has received that money from a landlord point of view, they absolutely have a moral and legal imperative to pay that money back. And as I say, if it hasn't been already done so, and I'm not aware as to whether it has or not, then it should be pursued by the Department of Finance.
And Enda, I think that I only can speak for my actions. I only became aware of this situation on Monday evening, and from then until now, on Thursday lunchtime, we've taken immediate action. We established the facts, we established who was responsible, and we have taken action. And I think that's clear and decisive action that was necessary, because this is not an acceptable situation. We do not accept any of this. We take it very, very seriously, which is why we've taken the action which we have, because we want the public to see that we take the issue of public funds very, very seriously. I think it's very reasonable to assume that I would have worked on the basis that no elected representative or area would have received this scheme, because that was the scheme rules. But as soon as I became aware on Monday evening, then we took action immediately.
So we know then who has been punished this evening, but we do not know how all of this happened, how it came about, whether that £10,000 in each account was actually spent, whether it remained untouched for the course of the past 7 months. And we also know as well, and ask the question as Malisha McHugh, why he hasn't resigned in all of this, because he made it known that he was aware of this money, and yet and all it was allowed to sit in that account, and he, as the person you would think in charge of the office where the buck stops, is still in place this evening. And just to the First Minister, we also learned this week, which was a figure I think was perhaps lost in a lot of the political plot that was played out, there was £4.5 million paid out to businesses in Northern Ireland by mistake to provide protection from the COVID-19 pressures when they didn't qualify for that money. What trust can the public have in how you're operating these finances and these support schemes when so much money like that goes to the wrong destination?
Well, firstly, and to start with what you've asked of me, I mean, the people who were responsible for those who are those that have been held to account. I think our statement's actually quite detailed and sets out the different scenarios and actually where we've accepted the resignations. The money was paid into Alicia's account, and she was the individual that was responsible for returning it, so she had sole responsibility, and therefore we've accepted her resignation as the right and proper thing to do. In West Tyrone, it was a party official who was responsible, and they have resigned. And I think, again, I accept that resignation as the right response in this situation. Alicia McHugh was very clear in direction in telling the official that the money needed to be returned, and worked on the basis that it was returned. So I think this is the appropriate action in this scenario.
And in relation to the scheme, I think people need to think back to when we introduced the scheme and the fact that we were working at pace. And actually, the Auditor General was brought in at that time in the design of the scheme with the Finance Department and with the Department for the Economy, so that we could work at pace but try to get this out to businesses who were absolutely crying out for assistance at that time. And I think it's somewhere in the region of 24,700 businesses that benefited from this scheme. And when you take the fact that, yes, there have been people who received the money who should not have received the money, that is true, but it's a very small proportion of the number of businesses that we were able to help at that time. And of course there's learnings from all of these things, and we have learned from the LPS scheme as to how we can refine it and how we can put in the fact that we need to protect the government and public money from going out to people who do not deserve it and do not need it. So, as I say, we were working at pace. I think the amount of people that receive money who shouldn't have received money in the overall scheme is small, but we accept it is a large amount of money, and therefore we will be pursuing that money from people who should not have received it. Hi, Rebecca.
Hi, afternoon all. Rebecca Black from PA Media. I wanted to ask about schools. It's maybe been one of the more anticipated aspects of today's executive meeting. Was the decision to reopen schools as planned on Monday unanimous around the executive? Was everyone in agreement? And then also in terms of the practicalities of all the pupils going back to schools, will there be any other differences other than the mandatory rule for face masks on school transport? Are there any other tweaks or any other changes that have been brought in to protect the pupils?
I think there was some misunderstanding, Rebecca, about the executive discussion today. It was never envisaged that schools would not open next Monday. We said that schools were closed for 2 weeks. That is what they have been closed. They are opening on Monday as planned. The Education Minister and the Infrastructure Minister have brought forward a plan around public transport and then Education Authority transport, so that children, all post-primary children now, it's mandatory to wear a mask on those buses unless you have a reason not to do so from a medical point of view. And then also the Education Minister is putting out refreshed guidance around some of the other issues around the school gates, and we've talked about this. Although parents now don't go into the school buildings, we are a little concerned that some may be together at school gates and maybe not social distancing, not wearing a mask. Maybe there is a need for more careful looking at that, and the Education Minister will put out more guidance around that. He's also working with one of the parenting organisations so that we can get that message out around the need to be safe so that you protect your children and protect yourself.
I think it's a collective executive priority to keep our schools opened, and I think that's our collective will throughout the months that we have ahead of us of dealing with this pandemic. Our education and the welfare of our children is absolutely a priority for us. We want to do everything that we can to keep our schools open. I think that some of the financial package that's been announced today will help schools to be able to adapt and to support the school leaders. And I want to commend them for the work that they have done. And they have been absolutely amazing to carry out their normal role of teaching and educating our children. But alongside that, to manage this COVID crisis is really, really challenging. So we do put that on record. We hope that, as I said, this funding will help. Also, the additional measures of face masks for taking that down from age 13 to 11, I think, on public transport is going to be helpful. But again, I suppose we use this platform to encourage people, parents, those congregating, those going to schools, dropping off children, please stay apart and please continue to be responsible, because a lot of the information we would receive indicates that it's the activity that happens around the school, getting to school, the school gate situation, and what happens maybe after school as well. So it's those things that we're asking people to please be very careful on.
Okay, thanks for those answers. Can I also ask for a taste of what the mood is about the other restrictions, the closing down of the hospitality industry and close contact services? Obviously, earlier today, a judicial review taken by 4 businessmen who work in the beauty and hair sector was dismissed. There's rumours of more judicial reviews coming. These restrictions are due to last for next 2 weeks, but obviously a decision will be made after that. Obviously, the First Minister said today there's green shoots of hope. Chief Medical Officer seemed a bit more cautious yesterday when he was saying maybe it's not as progressed as far as he would have liked. And then just in terms of the taxi driver compensation, I think they were hoping for closer to £6,000 rather than £1,500 each. Can you comment on those matters, please?
I think firstly, we've said at the start that this was an intervention, that we needed an intervention because the rates were soaring. We've said we're not overplaying the situation because we're only midway through this period, but we do see some signs of hope. But I think it's unrealistic to think that at the end of the 4 weeks we'll all be back to normal, because that's not going to be the case. There are going to be restrictions in our lives for a period of time to come, certainly probably into the spring. But we're going to try. We've set out our stall and saying that we want to give people hope. We don't want to keep shutting down the economy. We don't want to keep shutting down our close contact services, and I absolutely understand their frustration. This is people's livelihoods, and we've set ourselves from the very start of this pandemic to say that we wanted to save lives and livelihoods, and we're always trying to get that balance. So I understand people's frustration. That's why whenever we knew that we needed to make an intervention, we also knew that we needed to be able to secure financial support for people, and we're able to announce that package. But we don't want to keep doing this. We don't want to keep going in and out of lockdown. So we're looking at what is the exit strategy, what is the plan. We're looking at, what are the cornerstones of us being able to get the virus to a level that we can actually allow people to move around more freely. So some of the things that are really, really important there are in terms of the test, trace and track strategy. So we're wanting to invest in that. We're also being told about advances in testing, which will allow things to be turned around much quicker. And again, all those things are going to be core to actually allowing us to be able to allow people more freedom. So it's not our policy, Rebecca, I suppose, to say to go in and out of eternal lockdowns, but we're realistic to know that we're going to be challenged for some time.
So yeah, just to add to that, of course, nobody expects on the 13th of November to go back to life pre-February of this year. I think we all know that we're going to have to continue to socially distance, to have good hand hygiene, to deal with respiratory hygiene as well, to wear masks in the appropriate place. Nobody's suggesting for a moment that that's going to all end on the 13th of November, but we said that this intervention was for 4 weeks. Therefore, it is to give certainty to those industries that we can work together again. And we're doing a lot of partnership working at the moment with a lot of different sectors. I totally understand the frustration of the close contact sector and of the hospitality sector, but we're asking them to work with us so that we can then have this strategy of living with the virus, but also allowing those people to work and to make a living. In terms of the taxi position, the Minister for Infrastructure brought forward a paper proposing the £1,500 payment to individual taxis. We had a good discussion around that. As Michelle has indicated, she still has £6 million in reserve, and of course we'll keep all of this under review. I think it's important to say that, including the issue of haulage. The Infrastructure Minister has indicated that the evidence is not yet there to have a significant intervention. However, we will keep looking at that issue because we recognise there's a need to support all of our industries, and we know the work that haulage does in moving around our agri-food and all of those other issues that they're fundamental to in terms of logistics.
Just to add to that, Rebecca, I forgot to mention it, that the taxi and the coach operators were a forgotten sector, and for some time we have been asking for a scheme to come forward. So we're glad that eventually we do have a scheme, albeit that we know that there's some disappointment out there among the sector that perhaps it doesn't go far enough. But we'll keep that under review and we'll work with the Infrastructure Minister.
Afternoon, Ministers. Nigel Gould, Downtown Radio and Cool FM. A couple of questions, if I may, with regard to schools. Just wondering, did you or would you consider in continuing to keep schools open, consider introducing remote teaching for the older pupils, those kind of year 12 to 14 age groups? And also, like has been referred to earlier on, and we've been hearing from a number of parents, many of whom are pretty apprehensive, not by the fact that their children are going back to school, but about the potential transmission hotspots outside school gates. It seems to be a really big issue with many of them. How worried are you about this? And what specific message or plans are you considering to stop it?
So, Nigel, you will have noticed that even in places like France and Germany, where they are going back into national lockdown, that the schools are still remaining open. And there's very good reason for that, because we all know that the mental well-being, the physical well-being of our children is so important, their educational chances, their life chances, and therefore it is incumbent upon us as the executive to prioritise our young people and to make sure that they have access to education. So that's what we're doing. We're of course watching everything that's going on, but it was very clear that we wanted to prioritise, as Michelle has said, it's a shared policy objective to make sure that our young people have access to education. We've already said as well that the transmission issue around school gates is one that we have been alert to, and it's why there's new guidance going out from the Department of Education around that issue. But we do recognise that that guidance will go to schools, so that's why we're working with parenting organisations as well, because it's the parents and the older children that we need to try and reach to make sure that they have personal responsibility for their actions when they're outside of school as well.
I suppose just our direct message to parents is to please be responsible and to understand that our priority is to try and keep the schools open, and we'll support the schools in doing so. But the challenge is going to be that activity that happens in getting your children to school, the school gate situation and all of that. So we're just asking people to please keep your distance and follow the public health advice when you're there.
And a follow-up question, if I can?
Yeah, go ahead.
Given that pretty much the cases are currently coming down in every area in Northern Ireland, I think it's only about one where it's not at the moment. I mean, doesn't that mean now that, going forward that, a circuit breaker is more than likely the only show in town? I appreciate what you've said before and you've said in the past, but, I mean, is there another plan after the full 4 weeks then?
I think whenever you look at the fact that the rates are coming down, if you remember, every time we take or bring forward an intervention, it has a lag period in terms of when it takes effect. So I think what we're seeing, I think Derry and Strabane actually is the best example that we can point to say to people that with determined effort and people working together, you actually can change the transmission of the virus and bring it down. But we had household interventions in place, measures and restrictions in place for a number of weeks prior to this intervention 2 weeks ago, and I think we're seeing the benefit of that now. And then we hope to see a continued benefit of what we've actually in place now for the weeks ahead as well. But, it is challenging. We're very challenged as political leaders right now to be able to manage our way through this. We're having to take some very tough decisions to try and support people as best we can whenever we have to intervene. But I think if certainly we're determined to focus on what else we can do, what added value we can bring to the whole test, trace and isolate system, what advances there can be there to allow us to try to get the virus transmission down and allow us to open things up as much as we can.
So, Nigel, the intervention is to bring the R below 1, and we're making good progress in relation to that. But then when we get it below 1, it's about making sure that we do the basics so that it doesn't rise above 1 again. And I think that if we come forward with our strategy about living with the virus and sending out very strong messages and regulations around what can be done and what can't be done, then there won't be a necessity to go back into that circuit breaker again. I'm on record as saying a number of months ago that there wasn't anything inevitable about having to put in further restrictions, but because the R number went up to 1.6, 1.7, we did have to take an intervention, and I really regret that. Because it has had a huge impact on our economy and on our society, and then we have to try and mitigate that by bringing forward support packages. So we're asking people to work with us so that we don't have to go into another situation of restrictions.
Hi, Niall Deeney here, newsletter. Given the dire situation in the hospitals at present, would the First and Deputy First Ministers support any request for assistance from the UK military, maybe in terms of medics or other personnel to basically back up the health service?
Yeah, absolutely. We've been talking about the capacity of the health service today at the Executive, talking about mutual aid, and actually I believe that if mutual aid is not possible from other health services across the UK, then to look to our military to provide backup support, particularly in and around logistics, for example. They could help with that and in other ways as well. So yes, absolutely.
I think it's unfortunate that people try to play politics with this issue. We need to do whatever is necessary to help save lives. The Health Minister certainly is of the view that there is capacity in the Tower Hospital, City Hospital, and that they can open up additional beds there as required. We think that the situation in our hospitals will peak over the next sort of week, where we'll see the numbers hopefully starting to plateau at that stage. But clearly our health service is stretched to the limit, and clearly our healthcare workers are stretched to the limit, and we've listened to many of them speak publicly over recent days, and I just want to again commend them for the sterling work that they're doing to protect our people, all of our people who may need the health service at any time right now. I think they're doing an amazing job in such challenging circumstances.
Could you just clarify, sorry, for the Deputy First Minister, whether that is, whether you've said there that we need to do whatever is necessary to protect lives. Does that include, in your opinion, the potential deployment of UK military and in order to support the health service in Northern Ireland?
Well, let me repeat for you again now. I've said previously, whatever is necessary to save lives is what I am determined to do. I've said that continually throughout the pandemic, but I really wish people wouldn't play games with something that is so serious. Everybody knows that the fact that there are particular sensitivities here because of the role of the British military in the past. But we're in the middle of a global pandemic. I am the joint leader of this Executive, and I will work with the Health Minister to do whatever is required to serve people. Hi, Ralph.
Hey, Ministers, can you hear me okay? Yeah. I just wanted to ask, the Western Trust had expressed concern earlier today about the low oxygen levels at Altnagelvin Hospital. Were we unprepared for the second wave of the virus, and should we have used the summer months to prepare ourselves better? And if the pressures in the hospitals remain, is it possible that the 4-week circuit breaker could be extended?
Well, first of all, let me say, in relation to the oxygen issue at Altnagelvin, obviously that concerned us all greatly when we heard that news this morning. The Health Minister has moved to challenge that and said that there isn't an issue with oxygen in Northern Ireland, and he was very quick to tell us that at the Executive, because of course we would have been asking questions around that, because during the last wave, if you like, of this pandemic, we wanted to make sure that that wouldn't be something that would concern us if this was to happen again in the autumn, and he assures us that there isn't an issue around oxygen, so that's something that we were very glad to hear.
I think that covers it, yeah.
Thank you. And just to follow up, this weekend fans will be allowed to attend Irish League fixtures. And I know Ulster and GAA, they're being played behind closed doors now. But after this weekend's fixtures in the Premiership, will fans still be allowed to attend? And does the Executive believe that they should attend?
Well, I think the regulations are pretty clear on this. There isn't any ban on fans attending elite sports as long as they can be accommodated and as long as there's a risk assessment put in place to make sure that everything is safe. I think particularly Ulster Rugby have said that the reason why they're not bringing fans is because if they put 600 fans into the Kingspan, then it doesn't justify all of the other security that they need to put in place around the stadium to allow them to come into the stadium. So it is a financial consideration for them, and I understand that. But in terms of the Premiership, it's important to say that fans are allowed, but there has to be a risk assessment in place and all of the safety measures have to be there as well.
I commend Rugby and the GAA for the action which they've taken in terms of closing down to spectators. I think that given the seriousness of the situation that we face, given the situation with the transmission of the virus, then I think that was the right action, and I hope that the football will follow behind that.